Today, we're diving into the fascinating world of electrocardiograms, commonly known as EKGs. To start, can you explain what an EKG is?
Sure. An EKG is a test that measures the electrical activity of the heart. It's a non-invasive procedure that helps doctors diagnose various heart conditions.
Interesting. So, how exactly does an EKG work?
Well, small electrodes are placed on the skin, usually on the chest, arms, and legs. These electrodes detect the electrical signals produced by the heart each time it beats.
And what do these signals tell the doctors?
The signals are recorded as waves on a graph. The shape, size, and pattern of these waves can indicate if the heart is working normally or if there's an issue like an arrhythmia or heart attack.
That makes sense. Are there different types of EKGs?
Yes, there are a few types. The standard EKG is a resting one, where you're lying down. There's also a stress test EKG, taken while you exercise, and a Holter monitor, which records the heart's activity over 24-48 hours.
I see. Why might someone need an EKG?
Doctors might order an EKG if you have symptoms like chest pain, dizziness, or palpitations. It's also used to monitor heart conditions or the effectiveness of certain treatments.
Okay, but is the procedure safe?
Absolutely. It's a very safe test with no risk of electrical shock. The most you might feel is a bit of discomfort when the electrodes are placed on your skin.
Good to know. What happens if the EKG results are abnormal?
If the results are abnormal, it doesn't always mean there's a serious problem. It could be due to factors like electrolyte imbalances or medications. Further tests are usually needed to diagnose the exact issue.
Are there any preparations needed before taking an EKG?
Generally, no special preparations are needed. However, you should inform your doctor about any medications you're taking, as they can affect the results.
That's helpful. How long does the test usually take?
The actual recording of the EKG takes just a few minutes, but with preparation and setup, the whole process might take about 10 to 15 minutes.
Quick and efficient. Can you talk a bit about the history of EKGs?
Sure. The EKG was invented by Willem Einthoven in the early 1900s. He won the Nobel Prize in 1924 for his work. His early machines were quite large compared to today's portable devices.
That's quite a legacy. Have EKGs evolved much since then?
Definitely. Modern EKG machines are more compact, accurate, and easier to use. Digital technology has also improved the clarity and storage of EKG recordings.
Are EKGs used globally?
Yes, EKGs are a standard diagnostic tool worldwide. They're used in hospitals, clinics, and even in some home health monitoring systems.
It sounds like an incredibly versatile tool. What are some common misconceptions about EKGs?
One common misconception is that EKGs can detect all heart problems. While they're very useful, they might not detect issues that don't cause electrical changes in the heart.
That's a good point. So what should someone do if they're concerned about their heart health?
They should definitely consult a healthcare provider. EKGs are just one tool among many that doctors use to assess heart health.
Thanks for all this valuable information. To wrap up, what would you say is the most important thing people should know about EKGs?
I'd say the most important thing is that EKGs are a quick, non-invasive way to get important insights into your heart health. They're a valuable part of modern medicine.
Absolutely. Thanks again for the great discussion. I hope our listeners found it as informative as I did.
My pleasure. Stay healthy, everyone.
Until next time, take care and stay informed about your health.